Good morning, I'm Rose Lee. As Florida's population continues to increase, healthcare providers are encouraging patients to take an active role to their healthcare outcomes. Know your insurance and benefits offered. Start the year with a wellness exam and discuss annual screenings with your doctor. Take responsibility to assess your healthcare decisions, including rethinking drinking for your well-being. All when we return. The American Cancer Society Facts and Figures for Florida in 2021 reports more than 11,000 colon cancer cases, resulting in almost 4,400 deaths. And colon cancer is on the rise in people under 50. According to a Harris poll, 73% of surveyed adults 45 to 49 years old believe they're at no risk or low risk for colon cancer. Colon cancer is one of the most commonly occurring cancers in men and women in the U.S., and screenings may actually prevent or catch the disease before it becomes serious. Here to share resources on rising rates and available screening options are two people with a personal connection to colon cancer. Dr. Angela Nicholas. She is the Chief Medical Officer of Einstein Medical Center in Montgomery, Pennsylvania, along with Scott, a colon cancer survivor and screening advocate. Good morning to both of you.
Good morning. Thank you for having us.
Good morning.
All right, tell us, Doctor, what the majority of young adults in their 40s know about their risk for colon cancer, and what's the reality?
Well, despite the rising rate of colon cancer in young adults, most people do not recognize that they are at risk for colon cancer. There's just a lack of awareness about the risk. You are at risk for colon cancer and what we consider average risk if you are over the age of 45 and you have a colon. Again, 2/3 of women don't recognize that they have a risk. Hispanic adults do not recognize that they need to get screened on a regular basis. It really is a problem across the United States.
Though the incidence rates of colon cancer is rising in young adults, why do screening levels remain low?
Well, again, I think most people don't recognize that they are at average risk for getting colorectal cancer. And you're at high risk if you have a personal or family history of cancer, have been diagnosed with a condition such as inflammatory bowel disease or Crohn's disease, or have other kinds of cancers that could, again, put you at higher risk. In addition, the age of colorectal cancer screening has been shifted, and I think that's causing some confusion. It used to be age 50, but the American Cancer Society and the United States Preventive Services Task Force got together, recognized that the age of diagnosis was actually shifting fairly dramatically to a younger and younger age, and so they made some decisions to move the screening age from age 50 to age 45 about 2 years ago. That, again, has caused some confusion. And so we're really here to talk about the fact that every American over the age of 45 that has a colon is at least at average risk and needs to get screened for colorectal cancer.
Is colon cancer hereditary?
Colon cancer can be hereditary. There are some familial diseases that put you at higher risk or significant risk for getting colorectal cancer.
Since this has affected my family, we don't know all the factors of why one gets colon cancer at an early age.
We don't. We think that, again, I think if you have a family history of polyps, you should understand what that means and then go and talk with your family doctor about when you should get screened. It may put you at higher risk and you may need to start your screenings earlier, which it sounds like you understand that risk, so I appreciate the fact that you bring this up. We know that the American diet, the obesity epidemic has led to this. And in addition, we saw the decrease, the 90% decrease in colorectal cancer screening during the pandemic. So we've really got to get everybody back in the saddle again and really seeing their family doctor and making sure that they understand their risk for colorectal cancer and get screened at least at age 45. Don't put off your screening because of the pandemic. I think We know that COVID is here to stay, and unfortunately, so is colorectal cancer.
Scott, tell us about your diagnosis and why you decided to get screened for colon cancer.
Well, I've always made health and fitness a priority, and I didn't have any risk factors. So when my doctor brought it up, I was a little bit hesitant. He offered up the Cologuard test, which was something I could do at home. It was during the pandemic, so they mailed me the test. I did it in the privacy of my own home. It's non-invasive. You mail it back, and I was shocked when I got the result. It was positive. Follow-up colonoscopy revealed a tennis ball size tumor in my colon, which they removed along with some lymph nodes and surrounding tissue. And a year later today, I'm cancer-free.
Wow, talk about a close call, Scott.
Yeah, talk about a close call, exactly.
Doctor, tell us about your personal connection to this issue and how it affected your professional life.
So my husband John was diagnosed at age 45 with stage 4 colorectal cancer. And unfortunately, he passed away when he was 50. He had a mission to make sure that everybody understood their risk and when they should get screened, and he's passed that torch along to me. I continue to do advocacy and make sure that everybody understands the risk and make sure that our medical professionals in our community are assessing our patients' risk. Interestingly, about 34% of Black Americans, while they're interested in colorectal cancer screening, almost 50% of our Black Americans have not been offered colorectal cancer screening. So make sure you go in there and talk to your doctor about your risk. It's really important.
Scott, given that colon cancer is the third most commonly occurring cancer in either men or women, what advice can you offer our viewers on steps they can take now?
Number one is to get screened. Talk to your doctor. Go to Cologuard.com. If you're 45 or over, you are at average risk. And if you catch it early, it's much more treatable. So just remember, the cancer doesn't wait. Age 45, talk to your doctor, go to Cologuard.com, catch it early.
Thank you, Dr. Nicholas and Scott, for joining us to create awareness of the importance of colon cancer screening to prevent or catch the disease at an early age.
Thank you, and thanks for raising awareness. We really appreciate it.
Thank you.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Florida leads again nationally as new residents and existing Floridians sign up for individual health insurance coverage during the 2022 open enrollment period. New data shows 2.7 million Florida residents signed up for or re-enrolled in health insurance through the Federal Health Exchange for 2022. So there's a tremendous need for more doctors, with Florida Department of Health reporting that there are almost 68,000 licensed Florida physicians actively involved in patient care for Florida's 21 million residents. Here to discuss primary care for Florida's growing population is Joseph DeCapua, CEO of Infinity Healthcare Group. Good morning, Joseph.
Good morning, Rosalie.
Joseph, how is the healthcare industry addressing its work shortage, and how will this shortage affect patients and the primary care offices?
The work shortage in Florida, as it pertains to healthcare, physicians, medical assistants, and nurses, is real. Healthcare is experiencing the same shortages that hospitality, supermarkets, construction, and restaurant industries are experiencing. It's not easy to find help, let alone experienced trained help.
So tell us, what has caused this healthcare workforce shortage?
A combination of the following: COVID-19, population growth, job dissatisfaction. With 3,500 people to one provider, threshold. In addition to Florida's physicians aging and set to retire in a few years, we have a shortage of primary care doctors. And according to Jacksonville University, Florida ranks last nationally for access to primary care physicians and limited medical students' residency training positions, and then most medical students don't choose a primary care residency. That equals shortage.
Joseph, what are the consequences of this shortage in the daily operation of the primary care office?
Usually, each doctor or provider has their own medical assistant. The medical assistant draws blood, takes vital signs, does EKGs, weighs the patient. They also do referrals, answer the phones, and fill in for the front office staff. In most offices, there are 2 providers. That means you should have 2 medical assistants. You should have a 3rd medical assistant to run blood, check the faxes, and make follow-up phone calls, as well as answer the phone. You have a referral clerk, front desk, and a checkout person. When you are short 2 or 3 staff members on a consistent basis, your operations do not run efficiently. Every part of the operation is adversely affected. Again, the shortage holds true throughout the healthcare industry.
Okay, then now let's discuss how this negatively affects the patient at the primary care office.
The implications to a patient is poor customer service, delays in answering the phone, extensive hold periods, longer waits in the office because you have 1 medical assistant for 2 providers, longer waits for a referral, less staff to answer the phone. Again, this holds true in all primary care offices. It's very frustrating for the office staff and the patient. The staff expectations from the patient having a pleasant experience during the visit becomes challenging, and higher levels of dissatisfaction of the visit. And the patient becomes frustrated with the staff, not realizing the reasons behind their disappointment.
Healthcare is a serious issue, and communicating between physician and patient is the core of addressing healthcare workers' shortage right here in Florida.
At Infinity Healthcare Group, we are committed to create a team approach, working together, and to offer the best medical one-on-one patient healthcare experience, with the goal to achieve the best healthcare outcomes. Learn more about Infinity Healthcare. Our patients and our staff is one family. Your viewers can learn more about Infinity Healthcare Family to reach their healthcare goals at ndhealthcare4u.com or call 954-586-8058.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. The National Center for Drug Abuse Statistics accounts alcohol-related problems are among the most significant public health issues in the United States due to stress-related issues that could be caused by COVID-19, a death in the family, the loss of a job, and crime, which is up. And 2021 alcohol-related crashes were reported as 800 in the state of Florida. Dr. Koob is the director of the National Institute of Alcohol Abuse and Alcoholism and a world-renowned expert. He joins us this morning to create awareness on how to recognize signs of alcohol abuse problems and ways to get help. Good morning, Dr. Koob.
Good morning.
We all know someone who drinks excessively, and we are concerned for their safety. So how can we recognize if a friend or a family member is suffering from alcohol use disorder?
So one of the earliest and very earliest signs is noting that a friend or yourself even, are making people uncomfortable with their drinking. And so that's early on. But to broaden that, it's impairment in social and occupational functioning, or the way I like to put it is, where you have deterioration in interpersonal interactions, or you're late for work, or you're not meeting work deadlines, or and all of these things are related to alcohol, and those are kind of telltale signs that something's amiss.
So, doctor, are some people considered functioning alcoholics?
The short answer is no. Because we don't know how they're functioning in all the domains of their life. And so, yeah, they may be able to get in their car and get to work and go through the work day. But, what we don't know is how they're interacting with their loved ones, whether they're shirking responsibilities with their children, whether they're, sleeping poorly and getting progressively more and more irritable. I mean, these are the parts of, quote unquote, I dislike the term functional alcoholic, but because it implies that someone is actually functional. And they may be functional in only certain parts of their life. And that's, and clearly they're going to be dysfunctional in other parts of their life.
Thanks, Dr. Koob, for defining that term. But nearly 14.5 million people in the U.S., 12 years or older, have alcohol use disorder. And according to the National Center for Drug Abuse Statistics, 95,000 Americans die from the effects of alcohol use every year. But doctor, only 7.2% of people diagnosed with alcohol use disorder received any treatment in the past year. And not always quality treatment. Why is that, Dr. Koob?
What we really need to do is get primary care doctors and anyone else in the mental health industry to screen for alcohol problems, and also get those individuals into some kind of treatment, or at least given some advice. And that's something we're working on currently at the Institute. We hope to, this year, coming up, provide a clinician's core resource that will go out to everyone who's a healthcare provider on what a clinician should know about alcohol. I think that lack of knowledge about what's available is a critical part of the problem.
COVID increased our nation's time held in their homes. Many people dealt with depression, anxiety, the loss of a loved one, illness, jobs, or other stress issues. What have experts observed about the impact of COVID-19 on drinking rates and health?
Well, I think all the stressors you outlined are that we've observed during the pandemic have only exacerbated the problems we have with alcohol, because negative emotional states is a driver for alcohol misuse, but it's also a driver for relapse for people who have an alcohol use disorder. We've picked up about a third of the population is actually drinking more during the pandemic, and those that are drinking more are drinking to cope with stress, and more of them are actually women, interestingly. And so, when you're drinking to cope with stress, you're on a slippery slope, because, yeah, the alcohol works for an hour or two, but when it wears off, these demons of loneliness and boredom and negative emotional state come back with a vengeance. And so you end up trying to fix the problem by drinking alcohol, and alcohol is actually making the problem worse.
Some alarming data from the National Center for Drug Abuse Statistics report Florida's alcohol abuse reveals 6,903 annual deaths attributable to excessive alcohol abuse, with 70.2% of those deaths that are male, and 57.5% of those deaths due to long-term alcohol abuse from chronic causes. So tell us, doctor, how can we help a friend or family member who has an alcohol problem?
Well, the first thing is not to be confrontational. That goes nowhere and backfires fast. The other thing to do is to, invoke a little bit of motivational interviewing and try and talk with them about how if they don't drink as much or get into problems with drinking, how much money they might save, and maybe they can buy that new car even. And you start adding up how much you spend on alcohol, it can be quite large, for example. The other thing is there are 2 websites that we have that will help people along the way that they can be referred to, and I'll mention those in a minute. But the other is, you can have individuals talk to their primary care doc, maybe about a physical. Primary care docs will pick up on problems with alcohol and maybe can start helping them along the way.
Where can our viewers learn more on rethinking drinking?
So the 2 websites we have are rethinking.niaaa.nih.gov, and the other is alcoholtreatment.niaaa.nih.gov. And you can actually find a treatment facility in your locale by typing in your zip code.
Thank you so much, Dr. Koob, for creating awareness to recognize signs of alcohol abuse problems and offer resources so that our viewers can live healthier.
You too, and thanks very much for the interest.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Millions of Americans just like you had the opportunity to make changes to their Medicare coverage last fall. But being proactive about Medicare coverage doesn't end once the annual enrollment period is over. Here to discuss how people should most effectively use their Medicare plan benefits to support their overall well-being is Chief Medical Officer at United Healthcare Medicare and Retirement, Dr. Philip Painter. Good morning, Dr. Painter.
Good morning.
Dr. Painter, Florida healthcare providers continue to care for patients fighting COVID-19. So how can people proactively take advantage of their Medicare plan benefits to try to get healthy or stay healthy during these challenging times?
It's a new year, and many people have new health plans that they've purchased and new benefits that they need to understand. So first thing I would say is take the time to review your plan, understand the benefits, understand your coverage, and know what you've got in terms of additional things you can get from a benefit standpoint this year. So great place to start, in my view, is think about what preventive services you might need with the new year. Do you need some cancer screening or other preventive care? Medicare plans have great coverage around preventive and screening care. So it's a really good time to assess that and get those things done. And then second, I would say, look at what extra things might be covered. So if you purchased a Medicare Advantage plan, you may have coverage for things like dental, vision, hearing. At United Healthcare, we have a program called Renew Active that gives you fitness club membership so you can start off the year right. Or we have a program called House Calls, where we'll send a nurse practitioner into your home to do a comprehensive assessment, understand your healthcare needs, make recommendations, and set you up right for the new year.
Doctor, shouldn't all Floridians start the year off with a wellness check?
Yeah, that's another great place. You can do that through the House Calls program, or you can do that through your regular physician. There's something called the annual wellness visit, which is covered, and that's a great place to start at the beginning of the year.
Doctor, here in Florida, about 4.7 million Floridians are on Medicare. That's roughly 21% of Florida's population. And many of those who are eligible for Medicare are retired or living on a fixed income. So every dollar counts. What tips can you offer to help them manage their health care costs?
Well, I think understanding what your out-of-pocket costs may be with your benefits. So understand what your cost share is for certain services. Do you have a copay or a percent of things that you need to pay? And what kind of services do you have a cost share for, like primary care visits, specialist visits, or hospital-based services? Take the time and really understand what your potential out-of-pocket costs may be given your plan, and then you can start to plan for the year. Now, Original Medicare doesn't have a maximum out-of-pocket spend that you can have in a year, but Medicare Advantage plans do. So understand what that maximum out-of-pocket is, and you can use that to budget and to plan through the year.
Doctor, what advice can you offer people to help save money on prescription drugs throughout the entire year?
Take a look at your prescription drug costs. You know, people are very concerned about prescription drugs, often can be a big cost for people. So I would say three things there. One is look at home delivery. You know, not only is that convenient for your stable medications, but it can oftentimes save you money. And then two, think about generics. Now, certainly you want to have a conversation with your physician and make sure that generic medicines are right for you in your particular situation. But another place that you can save significant money on your out-of-pocket costs for medicines. And then lastly, look at the pharmacy you use. If you use a local pharmacy, make sure that it's in the health plan network. That will lower your out-of-pocket costs or your copays.
Also, doctor, so if you order more in advance, doesn't your prescription cost go down?
Correct. That's great advice. And that's typically what happens with home delivery. Or now you can oftentimes get that 90-day or 100-day supply of your medicines from your local pharmacy, and that definitely helps keep your costs down.
All right, where can our viewers learn more so they can stay healthy in 2022 while saving money with their Medicare plans?
Sure. Easy place to learn more if you have a United Healthcare plan is go to uhcmedicarehealthplans.com, or take a look at the back of your ID card, whatever plan you have. Usually there's a phone number on there that you can call for further assistance or information.
So viewers, listen up now to the important tip. To stay healthy, make a healthcare concern list at the beginning of the year to bring to your healthcare provider to keep their out-of-pocket costs down at the end of the year.
Correct. Great thing to do. Plan your year out, both from a healthcare standpoint and a financial standpoint for your coverage.
Thank you, Dr. Painter, for your expert advice to simplify Medicare plan benefits to live a healthier life and save your money. Preventative screening is essential to early detection. Patients benefit from engaging with medical providers to maximize outcomes that improve your healthcare experience. So share with us your strategies to gain a positive patient experience in 2022 at facebook.com/Rose Lee Show, and follow us on Instagram at The Rose Lee Show. Watch this episode and many others 24/7 at RoseleeArcherShow.com. Thank you so much for joining us this morning, and we look forward to seeing you soon.